allows us to decide who can and cannot be in the trial and so on. So I just wanted to offer that as a possibility, that the node ought to be determined by the cost required to get a product to the market. Another possibility for those nodes might be we're just going to increase the probability that a patient will hit a 5-year marker in remission from 40% to 70% or something like that. You know, I just don't think that that kind of a marker, it would not define the actionability required by the elements of the system. It wouldn't give them the right questions that they've got to answer. So there's a long way of saying, I apologize for that, but taking the time to define what the questions are is critical for this group to be able to work together to solve these problems. I had some additional thoughts on the improvement we've already are making in the definition of the challenge. That we, in my work, we've framed this as the ability of personalized medicine, and Lee gives later more clarity to that when he describes it as having 4 P's: personalized, predictive, participatory, and preventive. I really am excited that we're making progress in this definition. A number of years ago, I was asked by a senior executive to, I gave him a report on a project that we had done that was about 20 pages long. And he threw it down on his desk and he said, it's got to be 2 pages or I just can't read it. And I then told him something that Oliver Wendell Holmes said. And that is, if someone asks me for simplicity before I've gone through the complexity, all you get is simplistic. But if I go through the complexity and then at the end I come out with simplicity, it is priceless. And if you go back in Einstein's work, this eloquent, simple equation, E equals mc squared, it didn't pop out of his mind as that simple explanation of complexity, but rather, you go back to his early works, they were conflicted and complicated and contradictory, you know. But Einstein had to go through all of that complexity so that he understood it so deeply that at the end it was simple. And I think that we must not be deterred by the complexity ahead of us. So for me, in the last year, gosh, I've gone through cancer and this stroke. I was diagnosed with lymphoma, and it turns out, by the definition of the people at Mass General Hospital, at this point there are 37 types of lymphoma. And right next door, people who are diagnosed with leukemia, they've got about 54 types. And we haven't even gotten to other parts of of the body that will have how many other types. But I imagine that at this point, we've figured that there are over 1,000 different types of cancer that somebody might have, and of course there are not that many types of cancer, and so we're going through complexity at this point, and I bet you that in the end, 20 years from now, if we keep having this meeting in Park City, somebody's going to announce that, I think there's probably about 23 diseases, period. and that will be our equivalent of E = MC squared for the precision medicine. But we shouldn't be afraid of going through the complexity, because we want at the end simplicity, not simplistic. I guess I would like to say that we should never worry, or we should never be afraid of going through complexity, because the result is simplicity. And if we're afraid to work together to work through this complexity, then all we will have is simplistic answers that don't get us where we need to go. Well, thanks for giving me just a couple of minutes to visit with you here. And gosh, I could be with you at this conference, but I hope it is a wonderful experience for all of you, and wish you Godspeed and all of my love.